Welcome to the Making Kids Count podcast, brought to you by Kentucky Youth Advocates, where we sit down with policymakers, community leaders, and youth to discuss ideas to make Kentucky the best place to be young.
This is Shannon Moody, Chief Policy and Strategy Officer at Kentucky Youth Advocates. Thanks for tuning in to the Making Kids Count podcast. Today, I'm joined by some key partners and experts in youth mental health, whether through on-the-ground programming, working directly with youth, behavioral health sciences and research, or state advocacy and policy. Today, I'm really excited about our panel, and I'm glad to welcome Representative Kim Mosier, who represents the District 64, which includes parts of Kenton County and serves also as the chair of the House Health Services Committee. Dr. Amy Brausch is a licensed clinical psychologist and a scholar with the Life Skills Center for Child Welfare Education Research at Western Kentucky University and is nationally recognized for her work in suicide prevention and youth mental health. And also Sarah Kidder, who is the executive director at the Kentucky Alliance of Boys and Girls Clubs. Today, we are excited to hear from the perspectives of the panel on the intersection of youth mental health, social media, and preventing youth suicide. So let's begin by discussing what the data is telling us. Kids are struggling in Kentucky and all over the United States. And what we know is that suicide is the second leading cause of death for youth and young adults in Kentucky. In 2023, the Kentucky Youth Risk Factor Behavior Survey reported that 18.6% of Kentucky high schoolers seriously considered attempting suicide, 8.6% of Kentucky high schoolers attempted suicide, and 24.6% of Kentucky middle schoolers purposefully hurt themselves. And around 16% of Kentucky children between the ages of 3 and 17 face anxiety or depression. That's a lot of numbers I'm throwing at you all. But thinking about your role within your capacity, I'd love for you all to talk about what you've seen within the conversation of youth mental health and youth suicide and how that really comes to the forefront. And then what are you seeing among our young people in Kentucky? And I'd love to start with Representative Mosier to respond to that first.
Well, good morning. Thank you, Shannon. Yeah, we are seeing exactly what your numbers are bearing out, and I'm hearing from constituents about their concerns. I even worked with some parents who were deeply affected by some youth suicides in Northern Kentucky in the last 2 years. And in really digging down on what seemed to help in our area, I sought to expand those programs statewide to really address some of the policy decisions that would get some of these programs down into other parts of the state. So these stories are incredibly sad. One of the moms with whom I'm working lost her daughter to suicide at 13 years old. She was, as it turns out, and parents had parental controls on social media, but that doesn't seem to matter. And this little girl, she was a little girl, was allowed to play on Roblox, which apparently has all of these pathways into other social media. And it took her into a really dark kind of area. And I really believe, and the parents believe, and all who have worked on this believe that it was really social media that led her down this dark path. And so from a policy standpoint, there are lawsuits that are happening through our Attorney General's office. There look to be some settlement funds that will come into Kentucky and other states. And we really sought to use those funds and direct them to programs that would directly help these families and prevent some of this really harmful interaction with social media and other things. But that was kind of the overarching goal of something that I worked on this year.
Yeah.
What we've really seen at Boys and Girls Clubs is what I'm sure everyone is seeing, and parents are seeing, and educators are seeing, therapists are seeing. It's the stressors that young people are facing today are truly daunting. They're very complex, and not to use a term that's been used quite a bit in the past 5 years, 6 years, they're unprecedented. As the pandemic was creating some isolation and uh, some loneliness in our kids, was right when cell phones became the accessory that everybody just has now, and social media companies were popping up all over the place. And what we see as the overarching theme between the harm of social media and the solutions, I think, is connection. The reason why these kids were turning to it, um, and adults turning to it in en masse, is because they're just seeking connection with a community, with someone who feels the same way about something they do, connection with someone who may feel different in certain ways and they can't express it outwardly. Just general seeking of connection. And that's what we see in our clubs, is that a really true antidote to some of these harms is creating connection in real life, with caring adults, with their peers, intentional programming that can help counter some of those harms. And so we're definitely seeing it on the ground, just as many others are. And we're very eager to be a part of the solution.
Yeah. Dr. Brash, from a research perspective, what are you seeing the impacts around youth mental health looking like?
Yeah, from the research side, there's a few different ways to look at it. One is to look kind of at nationwide trends, and then also to look at Kentucky specifically. So nationwide, those suicide rates for teens kind of peaked around like 2021, like right in the middle of the pandemic. And we have thankfully seen a very slight decrease. And last year being, or the most recent data we have is from 2024, I think, and we did see a decrease nationwide for most kids, not all kids when we break it down by different demographics. So that's a positive thing, that we are seeing a slight decrease. But looking at Kentucky, we are still above the national average for suicide rates for teens. So that's something to pay attention to as well. And then my research is mostly focused here in South Central Kentucky in terms of doing some, screening in schools. We do work with some of our local schools here, and what we're seeing is still about 20 to 30% in any given year are reporting they've ever had thoughts of suicide. And then in the past year, a little bit less, but pretty much in line with the numbers that you mentioned before.
And Dr. Brausch, what do you see as driving it? I know Sarah and Representative Mosier had mentioned social media. Are there other factors?
Yeah, that's a great question. It's really hard to pin it down to any one factor. We know suicide is very complex and it's very different for everybody. For some kids, it might be some experiences with social media, and I'm sure we'll talk about that more in terms of what kinds of experiences might have more negative outcomes versus other kinds of experiences. We are seeing, I think, in general, an increase in anxiety. I definitely see that in our college students as well. So there's a lot of anxiety and uncertainty. Some of the other work I do is in some treatments for suicide that are more geared towards teens. And in some of that research and some clinical trials, we're seeing teens say things that are a little different than we've seen in maybe some past decades in terms of what might be driving suicidal thoughts. And they're much more existential. We're seeing kids saying things like, the earth is dying, everything's a mess, politics are messy, all these kinds of things that teens maybe in past years wouldn't have as much exposure to, but since they have exposure to everything now, they're just hearing it all the time. So we are seeing that. And then I think you've all mentioned connection, and I think kids are really still trying to get back into that normal developmental space of social connection and being with peers. It's easier to be on a screen with peers than to be together with peers, so trying to find a balance there as well.
Yeah. So let's talk a little bit about social media as it's come up. And as we know, it is probably driving some of the information that young people are getting when it comes to those existential crises that they're feeling, and also seeking connection. But kids themselves are seeing the negative impacts of disordered social media use or frequent social media use in their lives. In 2024, 48% of American teenagers reported that social media sites have a mostly negative effect on people in their age group. So they are sharing themselves that they are seeing some negative impacts of some social media use or maybe frequent social media use. And then, we know that everyone uses social media in some capacity. It's become a tool for education, advocacy, connection. And we know also that kids' social media use is influenced by their parents' and caregivers' social media use. So we're seeing it in households, the frequency of that use. Why do we see it as such a problem for young people? And what are some of the ways that we can combat it or identify some of those alternatives? Sarah, you had mentioned the connection seeking at the clubs. What are you seeing are ways to reduce use or make use more healthy?
That's a really good question because I do think that to what Dr. Brausch said, there are ways that you can share. Kids are learning. Their news is on their social media platforms right now. How they're learning about the climate crisis, or how they're learning about government, or how they're learning about anything is largely coming from those spaces. And so we actually do have programs where we try to teach healthy relationships with social media, with media in general, with journalistic enterprises as well. How do you know what your reading is factual? How do you curate that on your own so you can be a more sophisticated consumer of whether it's just the news in general or just a participant in social media. But generally, I think the General Assembly has been a part of these conversations and at the forefront of them talking about limiting access, like physical access to devices.
Right.
They led those conversations with schools, and talking about age restrictions, talking about all those things. But to Representative Mosier's point about you can have age restrictions and is that really going to do what you think it's going to do? And so in our space, in out of school time and after school programs, we really see you can have all those pieces in place, but the best thing you can do is build engaging, safe, exciting programming that helps kids connect to each other, to their peers, build relationships when they think that they can only find friends who feel like them on a phone. And then with caring adults, with trained staff who their whole purpose that day is to connect to a kid, to know what's happening in their lives, know what's happening at school academically, know what their plan is for their future, build a plan if they don't see one right now. So that's what we're really seeing is how can we be the source of connection so there's less of a need to seek their soul connection through a device.
Mm-hmm. Yeah.
Yeah, I'll just jump in. Thanks for that, Sarah. That's so important. And I think when we're talking about policy decisions, yeah, we have tried age verification. It gets complicated. How do you work with the platforms? How do you mandate something? And like you said, it's only one piece of a very large puzzle. And so again, I think enhancing the ability of clubs like yours, the Boys and Girls Club, to work with students directly, to make connections, to work with parents. Parent education is a big part of this. And so, how do we best facilitate those conversations in our community? And back to the piece of legislation that I was working on, it was really about how do we allow for funding of some of those programs, and to really allow the experts and the parents and the students to come together. And it would include behavioral health experts and pediatricians and law enforcement and school teachers, and how do we kind of come together and come around these families and these kids and in a healthy way. I know we've probably all read The Anxious Generation and Jonathan Haidt's books, and it's really, in his opinion, important to get back to basics and how do we strengthen families and the family communication. Nothing drives me crazier than to be in a restaurant and see an entire family on their phone at the table. I think we need baskets in the middle of the table of every restaurant and say, just put your phone here. We're going to talk. And those dinner time conversations. I mean, there are so many things, but it really, I think, comes back to how do we best communicate with our kids? How do we support them in all of the things that they're facing right now? And it's very different from how I grew up. And it's not all social media, but the screen time seems to be a common denominator, and it's the one piece that we can focus on. Now, there are other things. Certainly, I think it behooves the platforms to monitor content, and I think that we need to hold the bad players responsible in some way. And so that's another piece of, if there is dangerous or nefarious activity happening somewhere, we need to know about it, and those individuals need to be prosecuted. So there's a lot to consider in this space, but I think starting with conversations like this and partnering on some of these policy decisions is how I can tackle it.
So I can add to that a little bit. I guess, again, maybe from more of the research perspective. But first, I want to acknowledge that, yes, I do think we are in an intergenerational space where a lot of parents did not grow up with smartphones or screens or their own iPads or a smartwatch or all of these things, and they did not have social media. And so there is that gap. And that happens in other generations. It's just, it happens so fast and the technology advanced so far that we're all still trying to catch up. So the technology moves faster than we can really study it and research it and then make recommendations about it. So we're kind of building the plane while we're flying it, which is also why it makes it so challenging. Because parents are really struggling with how do I set limits? When do I allow social media? And then also, as some of you have mentioned, how are parents modeling that behavior as well? How much are they on their phones? Are we on our phones at dinner time, for example? And then from the research side, people have been studying social media, but because it takes so much time and effort, and it takes a long time to study the effects over time and what social media, how it affects kids into the future. Again, we're still studying it. And then we know in some other countries, they're making some really big steps. Like in Australia, they have set a nationwide ban, or not a ban, an age limit for social media. And so that's kind of a real-time experiment that we will all watch and observe and see how it plays out. We're also seeing the same thing with certain school districts limiting cell phone access during the day versus others that are not as strict. So again, we kind of have some real-time experiments going on to look at that. And overall, the research we do have is pretty mixed, and some of it is, when it comes out, is kind of dated. So just as one example, I actually saw a paper that came out very recently. I saw it yesterday, and it was about social media use during your teenage years. Or they called it, no, I think it was labeled as screen time and how it affects people into young adulthood. And then I started to read the paper, and they started tracking this large group of teenagers when they were teenagers in 1994. When they were measuring video games and computer games, obviously very different. So again, it's going to take some time to get more solid data to make recommendations. So in the meantime, I think we're doing the best we can with how to do that.
Yeah.
Yeah.
So we mentioned some alternatives to social media, and Representative Mosier identified opportunities for that in the 2026 legislative session, and has spoken to those and has shown such great leadership in that space. I'm wondering, why are investments such a key in promoting positive youth development? And what role can Frankfurt play in 27 and 28 in ensuring young people have access to those positive, engaging activities? We know that youth who are engaged in activities after school, especially, are staying out of trouble, but they're also building skills and creating opportunities for learning and growth. But what do we see? As far as the investments in promoting positive youth development, what's the role Frankfurt can play, advocates can play? Representative Mosier, do you have any thoughts on that?
Well, we talk a lot about prevention and really have a hard time identifying what that looks like. And I think when we really start to think upstream from some of the negative effects of whatever it is, if it's screen time or a lack of connectedness for whatever reason, a lack of activity in schools and young children, we put so much on schools in terms of curriculum and all of the things that we expect the schools to teach our kids, but we're taking away physical activity, for example. And that is so crucial for young children to, and team sports and all of the things that we know really positively affect children and how they learn to interact with one another. Um, I think having really strong conversations with kids about uh, screen time and how important it is to just learn how to have a conversation, and maybe those frank conversations with it's really easy to be anonymous on social media and all of those things. From a policy standpoint, we have tried to eliminate phones in school, for example. We have worked on age verification. I am trying to kind of capture those settlement funds as they come into our state so they don't get swept into the general fund, so that they can actually be specifically appropriated for positive youth development programs. And part of the bill that I was working on includes doing a community needs assessment, because not every community is the same. And so to be able to flex and look at what a particular community can really use, I think is a really practical solution to at least getting funds out into the state. Now, I will never say that government has all the answers. I think it's really helping to empower our parents and build, kind of rebuild that trust in our schools and our community partners to really work together, put our heads together. And I love getting people around the table to talk about solutions. And I think we really need to get back to thinking about prevention and what that really looks like.
Yeah. Dr. Brash and Sarah, thinking about getting youth around the table and engaging them in more opportunities like sharing what they would like to do instead of screen time, or creating opportunities in their community. What are your all's thoughts on, like, how do we get youth voice at the table, and what are ways that we can really lift up those opportunities?
Yeah, I think it's really, really important to include youth in any of these conversations. Even on the research side, we've been more and more forming youth advisory boards for our research, a more community-based participatory research, so that if we want to like study what leads to youth suicide, we're actually asking youth about what we should study instead of just assuming we know all of that. So I feel like it's very similar here, that if we want to know what they need or what they think would be helpful, and they do like to be involved, because one of the things we recommend is, kids they have their worries, they have things they're very passionate about, but their voices aren't often heard, or they're not always invited to participate. And so getting youth involved with volunteer work or activism or anything like that, I think is really positive. And then they can kind of pay it forward and help us come up with the ideas that will help everybody.
Yeah, that's incredible. I had not heard so much about the research field being advised by youth, by the subjects, and I think that's an amazing new development. I am I have spoken about how much I believe in connection and believe in building spaces for kids to have those real life engaging moments. But to Representative Mosier's point and to Dr. Brausch, the really, I think, important thing about the way that Representative Mosier's bill was crafted this past session was that not only is it just a belief that any funds that come down from these settlements, potential settlements, that are being funded because of the harms that is found to be caused by social media companies, that those funds go toward prevention, toward what we know can be an alternative, an antidote. But also the fact that those funds would be earmarked for positive youth development programming, and those funds would go directly into communities. So to her point about the community-based assessment, to being responsive to your communities, one thing I see over and over again, we have 50 Boys and Girls Clubs throughout Kentucky. The experts in those communities about what kids need are the people working with those kids every day in that community. And they may vary from community to community. And those clubs are working directly with those families as well and having really important conversations with the families. They know what the families are going through. They know the challenges the kids are facing at school. And so for these funds, not just to go toward something that sounds like it's an important thing, but something that is actually responsive to a community's needs, those kids' needs, the programming or the engagement that could really that the people working with these kids every day see that these kids could benefit from. And I think that's the really beautiful way that this bill was drafted that could really have a big impact.
Well, I was very happy to have all of the help from Shannon and others in crafting the legislation. And it didn't get through at the last minute, but we will strengthen it and make sure that it does next year. So yeah, thank you for that. It wasn't all my doing.
Well,
Well,
Go ahead.
I'm sorry, Shannon. We've been speaking about ways we can get youth voice elevated in grassroots advocacy in this interim to help that bill be better positioned this next session. So youth voice is going to be central.
That's right. Yeah. We're so grateful for the wisdom that Representative Mosier brings around making sure that the voices of people impacted are directly tied to the solutions that are being proposed in Frankfort. And I know Rep. Mosier has been just such a champion for people in her district, but really all Kentuckians across the Commonwealth when it comes to health and mental health. And just really grateful for your service, Rep. Mosier, in that space. We had such a great conversation, and I learned so much, especially ways in which we can, on a policy and practice level, start to drive change for youth mental health and preventing youth suicide. We also heard about some alternatives to screen time, whether that's green time or connection or participation in out-of-school time opportunities, and also what our research is telling us when it comes to supporting youth and bringing youth voice and experience to practice and to driving real change. So grateful for Representative Mosier, Dr. Brosh, and Sarah Kidder for joining us today. If you or someone you know is in crisis, please contact the Suicide Prevention Hotline at 988. And also, please check out information about the work that's been happening over the last several years, led by Bloom, Kentucky, and the efforts to improve youth mental health and positive childhood experiences. Check out the Boys and Girls Clubs, especially in your community. And then also learn more about utilizing incoming social media settlement funds as we lead into the next legislative session, hopefully. Thank you so much for tuning in to the Making Kids Count podcast.
Thank you for listening to the Making Kids Count podcast. For more information and to listen to more episodes, visit kyouth.org/podcast. To support this podcast and our mission as the independent voice for Kentucky kids, please consider making a gift at kyouth.org/donate.